All right. Hey, y'all. Welcome. Thank you for your patience. If you were trying to join us live, I have Ashley Denoy here from Bodyworks Physical Therapy. We're going to talk about new mom life. As you can see, my little guy here. When and why you may want to see a pelvic floor physical therapist. And then if you do go see one, what to expect. I have my postpartum appointment tomorrow morning. I'm excited to come see your new office space. But I actually met Ashley almost a year ago now when I first came to see her, not her, another physical therapist, Diastasis, at her practice. Dude, seriously? Another physical therapist at her practice, because I was having some incontinence while I was running. And at this point, I wasn't pregnant with him yet. And I was almost 6 years postpartum with my first. So, the point of telling you that is, yes, ideally you go see after having a baby, but it is never too late to go see and have them help you. I was peeing while I was running and hush, dude. I have no idea what he was pacifying.
He is vocal.
Yes, he's a noisy baby. Dude, where'd it go? You dropped it. It probably went under my desk. Or I can't remember.
So did you go to a physical therapist after?
No,
okay.
It wasn't even something I had ever heard of. And even so, I at the time of seeing you, I was a postnatal certified personal trainer, and that wasn't even something in my course that they discussed, which absolutely blows my mind. But running was so important to me that I was still running even though I was exhibiting those symptoms. And it wasn't all the time, and mostly it was like running downhill. And the straw that broke the camel's back was I was getting really fast, and I was proud of myself. And my husband and I were running a race where we were on a team for his work, and we thought it'd be really cool to both, win, him for the male and me for the female. And I was doing really great. And then it came to like this long downhill, and I just like couldn't control it. I didn't even feel like I had to go, but it was just gushing out. And I was like, this is horrible. And like, what runner walks the downhills and runs the uphills? Like, what world am I living in now? Like, I immediately called you on, that was a Saturday. I called you on Monday and like never looked back. And I ran a race, one that you guys sponsored actually, 20 weeks pregnant. And I ran all the downhills, and I was so proud of myself. So, it's never too late, but this time postpartum, I'm going to do things a lot differently. And that starts with seeing you guys tomorrow. So
how many weeks postpartum are you?
I am 3.5. I'll be 5. Okay. Well, 5 weeks, 4 weeks postpartum on Friday.
Okay.
So, yeah.
Cool.
So let's start with, tell us a little bit about you and your business, and we'll dive into some questions.
Yeah. So, like Allison said, I'm Ashley, and I own Bodyworks Physical Therapy. And actually, Monday was our 2-year anniversary, and so it was really exciting. And I started Bodyworks really because I was pregnant at the time with my third, and I had issues with my back and like SI joint. My back just went out when I was pregnant. I'd never experienced anything like it before. And so with my first pregnancy, it was horrible. And I went and saw a women's health physical therapist, and she helped me get through some things. But even then, I didn't know that I should go see a pelvic floor physical therapist. I thought it was just for if you were having problems. And then with my second pregnancy, I still had some SI pain. And for those people that don't know what SI is, it's your sacroiliac joint, and it's where your bone and your pelvis or pelvic bones meet. So like on the back. And so, I was having some of those issues. And I also noticed when I was at the OB office that whenever I would sit up, I would see a big dome. And I was like, this is weird. Like it kind of looked like an alien, popping out. And I was like, is this like, she would always help me up and like grab my hand and like sit me up. And so I was like, is this normal? Like, should I be doing something about this? And she's like, oh yeah, like it's normal. It's not a big deal. And that's as far as she went. And so I had always kind of had this passion behind me that's saying like, oh, I want to do something for women, for moms. And it wasn't until I was pregnant with my third and we moved here to Greenville, I had no idea that I was going to start my own business, but I just realized there was such a need for women's health, and that everybody thought that what was common wasn't normal. And so I wanted to help people have more normal lives and just let people know. And so we've continued to grow, and we really help women that have, like you yourself, have incontinence or, stop peeing in their pants, if they have any sort of pelvic pressure, if they have any, that heaviness or back pain, or even just the abdominal separation. And we'll get more into that, I know. But we help them get back to full function, like you wanted to be able to run a race without peeing your pants, and, you got there. And so
while I was pregnant at that.
yes. And while you were pregnant. And so I just want moms to know, like, you can do it. This is not the way that life is meant to be, how it has to be. Just because your mom had it doesn't mean that you have to have it. So,
yeah.
Yeah.
And I love that that's your mission, is like also education. And you really inspired me. My experience with you all really inspired me to like learn more, because there was so much more to it that I didn't know. And that's why I got my corrective exercise specialist, and it just opened my eyes to, that like things are common, but they're not things you have to live with.
Right.
It doesn't have to be your quote unquote new normal. Like,
Exactly.
just because I'm a mom, I don't have to pee my pants, and I can go to a trampoline park and have fun if I want to.
Yes.
Or run or jump or laugh or sneeze.
Exactly.
All those things. Okay, so let's start with just the postpartum, because that's my appointment tomorrow, and then we'll branch into other things. Why should a woman see a pelvic floor physical therapist after having a baby?
So one of the main things, there's several things. So one of the reasons why you should see a pelvic floor therapist after having a baby is to really see how things are going, first off, and just, so like you're coming in at 3.5, almost 4 weeks postpartum. And so, what we would be doing and checking for is, we're going to be looking at your posture. We're going to be looking at how you move. We're going to be looking at your abdominal wall and seeing how things are. We might, like if you had any tearing, we might take a look at that. And really we typically will wait though for that internal assessment until a little bit further along, more towards that 6-week point, just because we want to make sure that you're healed up. And so the other reason is for prevention. He's okay. I'm used to it.
I can mute myself, actually.
Oh. So the other reason why is really for prevention. So in France and other countries, their requirement, they don't force you, but after you have a baby, they're like, here, you're going to physical therapy afterwards for like 10 or 20 sessions. So, it's not just like, let's just check you up and see what's going on. But if you were to have, there was a post just recently going around, which I really loved, because I always used the analogy, if you had an ACL reconstruction or something else, would you have physical therapy afterwards? Yes, absolutely, because things change and you have to get things moving, and you don't want it to get stuck, and you're going to have to relearn to walk again. And it's the same thing, not even same. It's more impact on your body after carrying a child for 9 months or however long you carried it for, and then pushing the baby out, or having a vaginal or having a cesarean section, and you need that rehab. And it's not just like, oh, you have the baby and everything's all good. There's a lot of things that happen during pregnancy, during labor and delivery, during delivery, that push period, and even afterwards. So we just have so many things to look at. And the reason why France in other countries, they do this is because they know that taking care of yourself after a baby is going to prevent you from having things like incontinence and prolapse and back pain and other things like that. And so just like you didn't have any issues until what, 5-6 years afterwards. Well, maybe you had like some back pain or, something here or there, but I don't want to speak for you because you're on mute, but maybe I could say something.
I did have some, it wasn't all the time. I'm not afraid of TMI when it comes to talking about peeing, but for the most part, I only had experienced symptoms while for some reason, and now I kind of know the reason, but at the time I had no idea. When I was on my period with a tampon in,
right?
When I was running, I would pee, and then,
right.
But that was, like few and far between. So it's like, oh, whatever, I'll live with that. But,
right. Yeah. And you don't really think of that. It's like, oh, it's probably because I had a kid, or, oh, this, other people probably have this issue, which they probably do. It's just that it's not normal. And so we're really trying to help women stop having some of these issues, prevent them from having it later on. And so, like, for moms like you that have gone through, it's just like, ladies, you can help yourself not have some of these issues later on. But I just spoke with a mom the other day, and I'm never going to push my services or our services on anybody. But they had just had a baby, and it was about 3 months ago. And I said, hey, I'm not sure if you've seen anybody, but we'd love to get you in, just for an appointment, just to kind of see how things are going. And they're like, yeah, I've thought about it, and like, I'm doing pretty good right now. And that's not even the point. Like, you might be doing great. You might be feeling fantastic. And that's great if you are. But in order for us to prevent us from having things later on, or just getting to the point that we actually need some help, and there's nothing wrong with getting help. I wish I would have known what I know now.
Yes, I've said that so many times. Like, I wish I would have known. I wish I would have known. And I think for me, it's not necessarily about just preventing issues or healing issues. It's about, like, y'all help me look at my, hips and glutes and how everything is connected, and move with so much more efficiency that, it's above and beyond like just the like healing problems.
Yes. So you're exactly right. So coming into us, we're not just going to look at you like just the posture. Like, we're actually like digging deep. Like, we are looking at, like you said, we're looking at how strong you are in different planes. We're looking at how, if you have really weak glutes, we can find those issues. Yeah.
That was me, not anymore.
I know in most women, they're like, my butt used to be huge. Like, not huge and like fat, but just like my butt was huge. Like, I had really strong glutes, but then they had kids, and they're like, now it's not.
Mamba is for real. And the posture changes that you experience, like compensations for the posture, that you do without even thinking, like, it all matters.
Yeah. And so even if you're doing squats and lunges all day, you're not doing them correctly. And so you're going to do that all day long. And eventually it's going to get to the point where those muscles aren't going to support you correctly. And then you're going to start having problems because things aren't working the right way, like they should.
Yeah. I love a quote from, like the owner of the Run Experience. It's a like running coaching. He talks about how like running injuries are never like just happen unless you like fall off the sidewalk and get hit by a car or something like that. Like, those injuries just happen. But the other running injuries are repetitive motions, or running injuries or sports injuries or lifting injuries. They're doing repetitive motions with muscle compensations and poor form and muscle imbalances that just build up over time, and then all of a sudden cause a problem, which is not really all of a sudden. It's been happening for a really long time.
Exactly. And it really is similar to if you any sort of disease process, or if you know, with type 2 diabetes or, you know, different things like that. And those things have, you know, your lifestyle, most of the time has been contributing to those things. And so some of the, like I said, the prevention standpoint and just like taking care of our bodies, we're really having to break it down. So even if you're not having problems though, and we're looking at it and digging down, it's just kind of like the running, like you said, a running injury. You know, even if you're feeling good, we might see something if you want to get back into running and say, oh, like we need to, and there's a protocol for getting back into running.
Oh yeah.
After, hopefully we can help you with that. But like they're like, you know, running, getting back into that, like we don't recommend you start running until, so we might have you start walking. But just like the ligamentous laxity and just things like that, there's a lot of research done on it now that we want you to take it slower. It's better for you.
And do the appropriate strength training to support it first, because
exactly.
I mean, running is people think running is just this easy thing that you just put on your shoes and you go out the door, but it's a like single leg dynamic exercise where you need to be strong enough and ready to do it.
Exactly.
So how is, I'm going to hop to the next question. How is an appointment with you all different than like the mandatory follow-up appointment that you might have with your doctor and your midwife or your midwife?
Okay. So kind of like going back to like what we do during the examination. So we really we want to know, how was your pregnancy? And a lot of times, like with you, we saw you during your pregnancy. And so, but we ask like, how was labor and delivery? How was your previous, so like if you've never come before and you've had other children, like how were those pregnancies and deliveries? What was the method? Like, did you vaginal, was it cesarean? Was there forceps? Was there an episiotomy? Was there any tearing involved? Because that plays a huge role as well. And, you know, some people are like, oh, well, I just had a little skid mark, but I mean, that's still a tear. And so, you know, so we'll take a look at that eventually after we've gone through everything. So the OB or a midwife or anything, I didn't have an internal assessment though with my midwife. With my OB, I did when I had my first two, but with my midwife for like a 6-week, it was just like checking on like mental health. How are things going? How are you feeling down there? And so we're asking those questions, but we're also, because we want to make sure, you know, that you're mentally stable. And even ACOG is really recognizing that, you know, you need to make sure mental, like postpartum, anxiety and, you know, the mental health component is there. And then they're also going to be checking, if you go to an OB, they're going to be checking your scar if you have, or like your, if you had stitches or an episiotomy, they'll be looking at your cesarean, and they'll be looking just to see if you're having any complications. Most of, like from my experience when I've gone, they're like, you're looking good, you can resume intercourse, you can do this, and like, how are things going? They're going
making
pretty
sure
good.
You're not bleeding anymore or that.
Yeah. Yes. And so, but what we're doing, we're seeing how you move, how you, again, we're checking your muscles, we're checking your nerves, because there are some, you might be kind of numb or feel some tingling or numbness. And we're looking at your scar mobility, see how things are moving if you have a cesarean.
Do you do scar massage?
Yes.
Scar massage? Okay.
Yes. So we really work on that as well, because that can actually cause some incontinence or leaking. And because the scars adhere down to each muscle, and then they can also pull, because they actually cut through, you know, all of the muscles. And so, but it can also cause back pain. It can cause pelvic or painful intercourse. And
Yeah, because your core and your pelvic floor are not two separate things.
Exactly.
Yeah, they work together.
So yeah, your core is composed of, your diaphragm, your lowermost abs, your pelvic floor, and your back muscles. So if something is off, there's going to cause some sort of asymmetry and dysfunction there.
Yeah. And what's interesting to me is that it could be something like completely outside of your core and pelvic floor that's causing the issues too, with your posture, your alignment of the rest of your body. And you all look at that.
Yes. And so we'll look at how you're standing, how you walk, how if something, honestly, like your foot could be causing a problem.
Yeah.
So we are looking over head to toe, seeing how your joints move, seeing how your back joints move, because they might be too stiff and we might need to loosen them up, or if they're too loose, we might need to give you more stability. So it's a very comprehensive examination that we're giving you, and then we're constructing that plan of care for you, so that we can customize your goals, so that we can get you to where you want to be.
So we touched on I probably a lot of the components already, but like what to expect in a visit. You'll ask a bunch of questions about the pregnancy, the delivery, your experiences postpartum so far, maybe questions about pain, and then you'll look at posture, movement, what kind of movement assessments.
So we'll look at how you're getting down onto the floor. If that's something that you need to go do. We're looking at how you move. We look at how you squat. So squatting is not just for exercises. Squatting is to get off and on the toilet. Squatting is looking at how you get getting in and out of bed, making your bed, changing your child's diaper. Where is your crib located, or are they sleeping with you? We might be looking at when you're doing a changing table, like where are you changing your kid on your low bed, or is it we might have to change some things up. So those are the sorts of movements that
just also like how it integrates in your daily life.
Yes. Yes.
Okay. So you mentioned internal exam as something that you may do at later appointments.
Yeah.
Since we can't see the pelvic floor or really even feel it directly without an internal exam, what specific things are you looking at to assess its strength and function?
So, yeah, you're okay. So what we're doing is we can actually assess the pelvic floor muscles externally, and we can feel if they're contracting or not contracting. And so that's what we would be assessing. When you come in, are you able to contract it or relax it? We can actually see a lot of things externally as well. So we can palpate through your clothes, but then we can also, if we're looking just straight at the vulva, if we're looking at that, then we can actually see, are you contracting when you're coughing? Are you bearing down when you're laughing? Are you bearing down when you're actually supposed to be do, if we said do a Kegel, a lot of people bear down and they don't even realize it. And so that's why we tell people don't do Kegels if you don't know what you're doing, because you can actually be making your problem worse.
Yes. Actually, that was a question I have. Why in general is do your Kegels not the best advice? For what you just said, but any other reason?
Yes. And so some people are really tight. And so
That's my problem.
Yes, if you have tight pelvic floor muscles and you're continuing to strengthen them, then they're just going to get tighter. You have to train them to relax. And so we can teach you some down training techniques to get them to relax. But we can also do some manual work. So like you said, you can't see the pelvic floor muscles. So how are you assessing them? So, and I know this is just, we're talking postpartum here, but also just if somebody is curious, they're like, oh my gosh, I don't even want to talk about an internal exam because it scares them, because they do have pain. We have had, I'm good. I thought I was losing you. We do an internal assessment, but first I'll just kind of walk through what it looks like is we'll do an external exam and we'll make sure we'll touch kind of all around just to see like your sensation. Does it hurt, or like, does it feel okay to you? Some people are very sensitive and it doesn't feel good to them. So we might just start right there. And if we have to do that for a month before we start working in, then that's totally fine. And so we will look to see if somebody is contracting or bearing down when they cough or sneeze. And then we will start in like the lowest layer. And so we'll start like with the very tip of our finger. How does that feel? Can you contract? Can you relax it? And then we'll go in another knuckle and we'll have you contract on the other side, and switch to the other side. And again, like, how are those muscles feeling? Are you contracting them? Is there anything that feels different to you? And then we'll go down to another knuckle. And that's when we're really assessing the pure muscle strength, where we're getting a full grade, where we can actually grade your muscle strength. Like I said, with the other way, when we're testing externally, we can only tell if you're contracting or relaxing. We can't tell like what the actual grade is.
Yeah.
Right. Okay. And so with that, we're able to tell, like, are you able to contract at all? Are you able to contract?
And then with contracting, there's kind of like two parts, right? There's the ability to squeeze and then lift, and some people can do, and then hold it for, right, and have the endurance.
So, yes. So we will test. I'm glad that you're asking all these questions, because people want to know. There is, can you contract it, and can you hold it? And then can you do that again? And then can you do that again? Just to see like how much endurance you had, right? And then the other one are quick flicks. Can you contract, relax, contract, relax? Are you able? I'm doing it as we're talking.
Yeah.
And so, and nobody even knew. So, but yes. And the other thing is like the highest grade is, can you contract, and does it lift and pull in? Actually, like, does it pull up toward your head? That is a full 5 out of 5 strength. Okay. So, yes, that's how we're assessing it.
Okay. So we've talked about how we assess the pelvic floor. Let's move on to the core.
Yes.
You mentioned the doming that you saw, at the very beginning, with your experience in your pregnancy. Like, what do you look for in the core in the exam?
So with the core, we're looking at to check for diastasis rectus abdominis, or DRA, or diastasis recti, however you want to say it. And so what we're testing for is to see if there is a separation, but also, most importantly, what does that linea alba feel like? So with the linea alba is the sheath, I know that you know, but it's the sheath that connects the rectus abdominis muscles. And for those of you that don't know what that is like your 6-pack abs. Mm-hmm. And so we're looking, and actually during pregnancy, we have that, so that when we're growing, that actually they start to separate, and that's normal. Mm-hmm. So I don't want people, there's so much fear saying,
yes, I know.
Oh my gosh.
The people talk about trying to be able to like prevent it. Like, we don't want to prevent it. It's natural, like, part of pregnancy, but it's about core function when you really get down to it.
Exactly. Yes. And so we are testing that. And honestly, about 75% of, women that have that after pregnancy, it's going to go back on their own. Mm-hmm. But the thing is also, so we're not trying to scare you with it, but we also want to make sure that your core strength and your core function is there. And like we just said, like, even if it's healing, that doesn't mean that strength is there and that your whole core is where it needs to be, because there are a lot of components that go into that.
You can heal your separation and still not have a fully functioning core.
Right.
It's not just those particular abs that matter. Oh, did I lose you?
Right. Oh, hello.
Yeah.
Is it working?
You went slow-mo for a second, but I think you're back.
Okay. I'm good?
Yeah.
Okay. So like I was saying, your ACL reconstruction is going to heal.
Mm-hmm.
But if you don't do anything about it, then, I mean, you're not going to be in the best shape that you can be. So we're assessing that, but we're checking for that linea alba. Like, is it really soft, like your cheek? Is it firm, like the tip of your nose? And if it's soft, like the tip of your cheek, we need to work on creating that tension there so that you can function well.
So you look at both the, like, you know, the standard, what everybody talks about is the width of the separation. But
right.
What you're saying is, and you know, the pendulum is swinging, and because, you know, nobody talked about diastasis 6 years ago when I had my first, and then everybody talked about it like with this huge fear of like, how many finger separation do you have? And now we're kind of swinging back to the middle, saying, okay, it's something we need to worry about or address, but it's not just about separation. You can have some separation and have a really strong functioning core.
Yeah, if
it's more firm than not.
And if you're able to feel your pulse when you lift up your head, or like you feel like you can actually like stick your fingers real down deep and could like go down to your spine, then your linea alba needs some work. Also I don't know why I didn't say this before, but literally the biggest thing that we're looking at when you come into is your breath. That is the first thing that I will work on with women is your breath. Like, what sustains you? Like, how do you live? You have to breathe in order to live. And so when we're pregnant, our diaphragm isn't moving the way that it should be. Your baby's pushing up on it. And so this is part of the core as well. And so we're looking at how your ribs move, and that goes into your posture. So like I said, there's so many different components. And so just because
your ribs expand out during pregnancy, and that affects the function of your diaphragm. And then, you know, part of retraining your core has to address, you know, that as well.
And then and then we have to look at your thoracic spine, which is like your upper back. Like, if that's not moving well, you're not going to be able to breathe as well either. So that's like one of the biggest components of the exam is making sure that we can breathe. And I mean, to be honest, I will spend a whole session I was spending a whole session going over breathing with somebody. And for example, one of our patients, when I was treating someone last year, and she was like, I'm not kidding, but this is like right when Janessa was coming in, and she's like, I'm telling you, after I was breathing differently, I could put on a pair of pants that I could not wear before. And then like, it's literally been life-changing by how I'm like, when I go pick up my kids, when I'm going on a walk. But she's like, all I've been doing is breathing, and I can wear a pair of pants without having to suck in ones I couldn't wear before. She's like, I know that sounds crazy. I was like, no, it's not, because it's just, you had so much more pressure in your abdominal cavity than you really needed to. So
breathing is where it all comes together.
It is, right? What is your baby?
Yeah. I posted yesterday or recently, like the process of, you know, of postpartum rehab, and really breathing has to come first, right? Breathing, then your pelvic floor, which is kind of connected into your breathing, your core, your posture, and then you can start working on everything else, your goals. Moving back to running or the gym, but those things need to be.
We're not going to continue to move on, and we're not going to progress you unless you've met those marks, you know. So if you're not breathing right, that's what we have to start with.
Okay, so one last question, because we talked a lot about postpartum. What other situations or with what other symptoms would you recommend people coming in to see a pelvic floor PT? During pregnancy, potentially as one of them.
Okay. So during pregnancy would be if you're having, so again, we actually had some women, they want to come to us during pregnancy just because they want to make sure that they have the best pregnancy that they can, to make sure that they have good function, but then also we help them prepare for labor and delivery. So we can help show them the best positions that they can be. So say you're having back pain. We had somebody that went to our postpartum or our pregnancy workshop when I was doing them a little while ago. And we had a pregnancy workshop on a Thursday, and we went over labor and delivery positions. And this was her third child, and she was having sciatica, like the pain going down her leg. And she was like, I've been through physical therapy. And like, so we talked during this pregnancy workshop, and she sent me an email on that Saturday evening, was like, hey, I just wanted to let you know I had the baby this morning. And I was like, why is she sending me an email when she just had her baby? She's at the hospital. But she's like, I just wanted to thank you because what you taught during that pregnancy workshop was extremely beneficial. Like I didn't have any of that pain going down because I showed her the positions that she should try and what she should avoid. Oh, my battery's dying like crazy, so I'm going to talk fast. So pain, if you're having any sort of limitations with activities, if you're having
especially in that SI joint area.
And pubic symphysis, honestly. So that pubic symphysis is right in your groin. If you're having pain, like they call it lightning crotch, like if you have it, you can relate to lightning crotch. And so any sort of vaginal heaviness will cause, or is another reason. But yeah, labor and delivery positions, also like getting ready for like a perineal massage, just for the crowning point of it. And then outside of pregnancy. Oh, and also if you do have diastasis rectus abdominis, but it's severe, we can help you, show you, modify different activities, and we can also do some taping. So movement is very key. So you just want to make sure that you're moving in a safe and efficient manner. But yeah, outside of that, the same thing, the leaking, the pain in pregnancy, or the pain in intercourse, the pain with internal gynecological exams. Even if you're having fear with that, we can help you with that. So
low back pain,
low back pain, upper back pain, hip pain. I just talked to another person that has, they said that they have bursitis, the orthopedic doctor did, and they actually are having ischial tuberosity pain, which is like right in the groin area. This wasn't our patient. This was another PT friend of mine, but just saying like, we really do figure out like what that root cause is of those issues so that we can get you back to where you want to be.
Looking at the whole body and
not just the
root cause instead of just treating the symptom.
Exactly. There are so many people that just like to look at that pelvic floor, but there's so much more to it than just that. Did we just work
analogy
with your pelvic?
I always draw to that is like, when you see the people who have like running injuries and post in the running group and everyone's like, oh, go get like new shoes. And I'm like, no, it's not about the shoes.
It's
like,
not your shoes.
Go look at how you move. Get your gait analyzed, like strengthen your glutes. Like, no, stop telling people it's about the shoes. Like, no more Band-Aids. Like, learn how to move your body efficiently, effectively, and function properly. And that's why I think what you all do is so important.
Well, thank you. And what you do is so important as well.
Yes. I'm like the next down the line. Like
Yes. And so like what you said, like when you came in, we didn't just look at your pelvic floor, right? Like that was just like a teeny component of it. Oh, he's upset.
He wants to keep eating, but my letdown is like crazy. He'll end up choking, and I'd rather do that all off camera.
No worries. I've got some Haka things if you want to borrow them.
I have that too. I love those things. Another thing that didn't exist with my first that I think is the best thing ever.
Yes. That's what I had with Willow. So.
All right. Well, thank you so much. And
thank you for having me.
we'll see you tomorrow.
Okay.
And I will post this video shortly.
Okay. Great. Thank you so much, Allison. It was so great to see you.
Good to see you too.
Bye.